Okay, hi everyone. So thank you so much for joining our session today with Dr. Nicola Gates. Dr. Gates is a clinical neuropsychologist, a researcher, author, registered health professional promoting adult health and well-being for over 25 years. She wrote 2 bestsellers, A Brain for Life and The Feel Good Guide to Menopause, published by HarperCollins. And she specialized in neuropsychological assessment of acquired and traumatic brain injury in adults and psychological injury in adults with over 24 years experience. She's done a seminar with Mac before on persisting symptoms after concussions, which you could view it on our YouTube channel. And we'll be doing another one with us on the 18th of May at 1 p.m. about COVID brain, a neuropsychological perspective. She's also done a lot of work for us and is highly regarded and lovely to work with. Over to you, Dr. Gates.
Thank you. I have to say this is quite unusual in the sense that I don't really know what's expected, but that was a very kind introduction. So in actual fact, it's probably closer to 30 years clinical experience. So I trained in Melbourne University and I chased a job in the Royal Rehabilitation Centre Brain Injury Unit, and started there at the end of 1993. So the maths would be 30 years. And I worked there covering spinal unit and the brain injury unit. And then I moved into a community role, principally with the Commonwealth Rehabilitation Service. So getting injured workers who've had an acquired brain injury or traumatic brain injury or psychological injury back into the workforce. And I think that's important because I am a self-confessed nerd and I do a lot of research. So the books that I've published and my PhD and other things, I call them my little side hustle. And so my side hustle involves a lot of research, obviously a PhD. My books were 3 years each of research as well. And so I'm quite a nerdy type. So I'm the sort of person I read the intergenerational report. I keep up to date with the Australian Bureau of Statistics, and I go to ComCare. And, work is vital for people's well-being. And we know that it reduces mortality and morbidity. Why am I telling you this? Because as a self-reflective clinician, which we are asked to be, I'm very aware that I have a bias towards supporting people get back to employment in some form of another. And I know that not everybody might find that an attractive proposition, but that's my standpoint because all the research consistently shows that employment of some form gives meaning and purpose, improves psychological well-being, and as I mentioned, reduces illness and early death. And it was the prevention of death with disability that led me to write my first book, because I have been at the bottom of the cliff, and that's obviously where my work is, but I wanted to empower more people to make good choices to improve their brain health and their psychological well-being, and that was the impetus behind my books. Little nerdy disclosure, my dad is a world-renowned scientist. He's a member of the Royal Society in the UK, so if anyone's nerdy, you'll realise that the next place to go after that is a Nobel Prize for contributions to science. And I grew up in universities all around the world. I'm actually North American born. Why is this relevant? Because the caliber of the people that surrounded me in my childhood told me to be curious, to be generous, and to make science accessible. And I think that does influence my practice. I do medical legal assessments. I also do provide clinical diagnostic assessments, so non-medical legal, and I also provide treatment and intervention. And so, for example, I have increased my skills, for example, in some clinical work for post-traumatic stress disorder, because when I worked in the brain injury unit, obviously it was very evident that people often have issues before their head injury, drugs, substance use, and maybe some psychological issues, particularly in younger younger population, single vehicle, but also afterwards can have a lot of psychological issues. So I adhere to the biopsychosocial model, and I provide treatment for depression, anxiety, stress, and PTSD. So I think that has enabled me to have a big view, and I think I am receiving increasingly complex referrals where there's multiple things going on. So, for example, I saw an income protection person yesterday. This person works at one of the major 4 banks as a senior person, and they had a heart condition that required them to have some surgery on their heart. Now, they haven't worked for 4 years, and when I unpackaged everything that was going on, only sort of 10% of people who have similar heart surgery can report cognitive difficulties afterwards, but they are supposed to ameliorate over time. And when I unpackaged everything, this is a woman in menopause, and that's relevant because we know that in menopause, estrogen has a benefit to the heart, so that increased her coronary risks, which is probably why she presented with the heart attack initially. We also know that menopause results in brain fog. We also know that it increases depression. So there's a few things. But also she had a history of severe domestic violence, including strangulation, which has significant implications for brain health. And so there are in this case multiple factors that would contribute to her presentation and complaints of brain fog, poor attention, poor memory, and so forth. So they all have to be unpackaged. And this person has already been seen by a clinician with only 10 years experience. And they, I guess what I'm saying, there's something about age. I don't think wisdom necessarily happens with age, but age certainly gives you lots of experience. And they didn't identify all these things. So what else can I tell you about the influences on my practice? I don't know if anyone's got any questions for me. I see CTP, workers' comp, income protection, plaintiff and defendant. I do joint assessments. I do telehealth assessments, and I was doing telehealth pre-COVID simply because, people come into major cities by helicopter after catastrophic injuries, and then they often go back home into more rural communities, and they still require good service. So I've been doing telehealth for quite some time, and telehealth has obviously improved the platforms and so forth. But I've been doing telehealth for a long time. What else would be relevant? Has anyone got any questions? Because I said I find it quite unusual to sit here and sort of talk about my career and how I might be helpful. Has anyone got any questions they want to ask me?
Yep, if anyone has any questions, just unmute yourself and just come forward. Or you can put it in a chat box.
I might be able to see it. Sophia, is there anything else you can think? I mean, you've hosted a few of these. What else do I need to say?
Well, usually they just introduce, and then if they have any interesting cases that they've encountered in the past, then they would share it with the attendees as well. So if you have,
Well, I'm interested in COVID brain because that's definitely coming through in workers' compensation. And the research is kind of indicating that there shouldn't be any long-lasting issues there. Sorry, for people who weren't hospitalised and respirated. There's other factors. Anecdotally, talking to my colleagues around the country, I've been phoning up colleagues. We're all noticing an increase in psychological aspects to claims. We're also noticing an increase in disingenuous, exaggerated presentations, and that seems to be happening across the country. And I'm wondering if that's a COVID impact. I think people have got very tired over the last couple of years. I think that's definitely coming through. I saw a person who had a cyclist hit by a car 5 years ago, and they're still reporting cognitive fatigue. Now, this person didn't have any loss of consciousness, but did have some headache word finding. And the only thing they've been complaining about is cognitive fatigue. However, this person's on devices for their job. They are on devices sort of 18 hours a day. And when you look at their life, I mean, yes, they've had other injuries absolutely attributable to the accident, but if there's nothing on cognitive profile, and they've been seen not just by me, they saw one of my colleagues before they saw me, and I provided them with cognitive strategies. And so all the cognitive difficulties that they were initially reported, we have probably saw them about 8 times. They've all resolved. So the only thing they're continuing to complain about is this cognitive fatigue, and it's likely lifestyle based, because that's what all the research is showing. People are very tired. People on media and devices are more tired because their brain's not getting any downtime, and brains like downtime. So I guess what I'm saying is it's really important to, and that's why I look at the stats from the Australian Bureau of Statistics, and I look at probabilities and likelihood and other things that are going on to put things in context. You have to understand the individual, but I think it's good to have a bigger understanding as well.
I think Anne-Mary mentioned something in the chat box.
Okay, I'll open that.
Long COVID was going to be hard.
Well, we're having a talk on it, aren't we?
Yep. So does anyone else have any questions that you want to ask Dr. Gates? Or is there anything else you'd like to share, Dr. Gates?
Well, no. When I'm not neuropsyching, I am a beekeeper. And since I've got an audience, I might just say that no pun intended, the bee industry, I'm not a commercial beekeeper, but without bees, we would have food scarcity within a year, like it would be catastrophic. And the bee industry in Australia is seriously hurting. So next time you go and buy some honey, I will invite you to actually pay proper money, because it's a serious issue. So I've had the Department of Primary Industries onto my hive, and they are destroying hives, and it's come down. The varroa mite is now in Hornsby. And it took New Zealand 3 years to recover after killing all their bees. So sorry, whilst I've got an audience.
No, all good. You've actually got another question in the chat box now. So it just came through.
So Nikki, what the research is showing, I mean, there's actually, unfortunately, there are over 1,000 papers talking about this issue, except when the research is distilled for quality, 95% of the research papers out there are very poor quality, and they're quite alarmist. So if people have been hospitalised and ventilated, their COVID recovery is quite different, because they've had a multifactorial assault on their body and multiple mechanisms that may have impacted the brain. What the research is showing, if people weren't hospitalised, as in it was a low episode, that there are other factors at play in their reports. So it's looking, and often it's stuff pre-COVID. So the cases I've seen, there were things going on pre-COVID, and they all told me that when invited to talk about themselves, life before COVID, they all said that they had issues happening pre-COVID, and that's what the research is suggesting.
Thanks, Nikki, for the question. Does anyone else have any question? Okay. I think someone.
Yes. Anne-Marie, yes, I'm obviously traveling is inconvenient. So it incurs the fees associated with travel. But yes, I will basically travel wherever. I did a joint assessment, 2 joint assessments. They happen to be both the same firms for both clients, but they actually worked out it was cheaper for me to go to Amsterdam and Brussels, back-to-back assessments. It was all over in about 5 days. But yes, I'm happy to travel.
Yep. So just the last round, does anyone have any other questions before we round up? Yeah, I think that is all for today. Thank you, Dr. Gates, for very informative session about the bees as well. But yeah, thank you everyone for joining. So Dr. Gates will be hosting another seminar on the 18th of May with us. So just I'll put that on Eventbrite and you could sign up for that on Eventbrite. Thank you so much, Dr. Gates, and thanks everyone for joining.
Thank you, everyone.
Thank you.